Hey, ReMar nurses, this is a remarkable Monday. You can, you will, you must pass NCLEX. That's what this is all about, you passing NCLEX. Hey, my name is Regina Callion MSN RN. I am the #1 NCLEX instructor on your planet, and I am here today because it's Monday, and every Monday we come together to talk about how you are going to pass your NCLEX exam. And this little episode will be focused on pharmacology. This is how to pass NCLEX. You made it live. So wonderful. And it's in honor of our free Pharmacology NCLEX review. That's right. In other words, ReMar Nurse University is happening right now every Monday. That means this Monday at 8 p.m. Eastern Time, RNU is going down. And the entire event will be based on pharmacology. So not only this Monday, but the Monday in June, the next Monday in June, the next Monday in June, the next Monday in June, all the way to June 28th, we will be participating in RNU. And so if you signed up for it, you need to have your workbook out and ready for tonight. All right, because we will be filling this out so that at the end of ReMar Nurse University, you will feel so comfortable and so comfortable and competent with pharmacology. That's the goal, is that you're ready to go. So download and print out your workbook because it is happening all for you right now. I hope you're ready for it. But let's get into our NCLEX question. The very first one is this. Comments on the screen. It is this. A nurse is educating a client undergoing a radioactive iodine reuptake test to study thyroid function. Which of the following instructions should the nurse include? Okay, so we know what's going on. Here we go. So a nurse is educating a client undergoing a radioactive iodine reuptake test to study thyroid function. Which of the following instructions should the nurse include? Number 1, you should not take this exam if you suspect you could be pregnant. 2, you should take your thyroid medication before the examination. 3, you will be given the radioactive iodine in the form of a transdermal patch. Or 4, this procedure will take up to 48 hours for the results to be determined. Here we go, guys. We are talking about this radioactive iodine reuptake test. Lots of education on your NCLEX exam. Be ready for it. Be prepared for it. What is the right answer? Go ahead, smash that share button too. Come on, let's share this video. I want to get 500 people watching because they have to know RNU is going down tonight. You guys are doing really well too. I see the answers on the screen and the answers are right. The answers are right. You are ready for this Monday. All right. The correct answer, you guys got it. Of course, it's number 1. Radioactive iodine is contraindicated during pregnancy. All right. So all of the other choices you do not want to include for the patient. So they do not take thyroid medications. Okay. They don't take thyroid medications before this procedure. All right. And the iodine, it's not given in the form of a transdermal patch. No. It will be either PO or IV. You guys knew that. You knew that. And if you didn't know this, between 1 and 4, if you got it down between 1 and 4, 1 makes more sense. The results come in 24 hours. 24 hours. All right, guys, we are moving on. We got another question coming up. Question number 2, getting ready for RNU. Yes, getting ready for RNU. Question number 2 says this. We're going to block all those scammers. Don't even look at the scammers that are posting comments right now. Number 2 says a nurse suspects her coworker is abusing narcotics on the job. Oh my goodness. Which action is most appropriate for the nurse to take. Okay, most appropriate for the nurse to take. Here we go. Is it number 1? Speak to the coworker privately about the situation. 2, schedule a meeting with the nurse manager about the coworker's behavior. 3, speak to the hospital's ethics committee on how to go about this procedure. 4, file a complaint. File a complaint with the Board of Nursing. Oh my goodness, do you know what to do if you are in this situation where a coworker could possibly be on drugs, stealing drugs? Oh, this is so common that they are putting it on our license examination. What is the best thing to do? Are you going to speak to that coworker in private? All right. Are you going to schedule a meeting? Shout out to Nikki, just got the VT. I'm ready for your testimonial. I'm ready for you to pass NCLEX. Yes. Is it number 3? Are we going to speak to the hospital ethics committee? Okay. And or number 4, which one are we going to go with? Number 4, file a complaint with the Board of Nursing. What is the best thing for that nurse to do? This is a new nurse exam. I see some 2s, I see some 4s, I see some 1s. The correct answer is actually, this may surprise you guys a bit. The correct answer is going to be number 2. This is the best thing for you to do. The nurse manager is going to address this situation. And I always have to remind nurses that we are not the managers over our coworkers. So if our coworker has a work-related issue that is affecting their work performance, it is not our responsibility to discipline, to speak to try to re-educate another employee. Okay, that's not our business. So we would have a meeting with the nurse manager. We would convey our concerns and allow the nurse manager to manage the employee that they hired. We didn't hire them. The nurse manager did. And so we have to be very, very careful that we are acting within our scope of practice. All right. And so I know that one can be kind of tricky, but we have to remember the difference between hospital administration and staff. Okay. All right. Let's go on. And yes, I love that. Never confront a nurse in these situations. Nope, you don't want to do that. All right. The last thing you want to do is confront a nurse. I like that. Okay. Question here. Thank you guys for joining. This is how to pass NCLEX. Here we go. Question number 3. Woo. The nurse hung the wrong intravenous cardiac medication for a coronary bypass client. Which intervention should the nurse implement first? 1, call the rapid response team due to potential interactions. 2, notify the healthcare provider. 3, complete the forms for the incident report. Or 4, consult the medication record and assess the client. What is going to be the intervention that is done first? In other words, this is a prioritization question. Okay, this is a prioritization question. And this is what we do. If this is your first time joining ReMar Review, this is what we do every Monday. I'm getting you guys into the mind frame to get those questions right on NCLEX. I see a lot of answers, a lot of different answers here. Some people are saying it's 2, notify the doctor. Go ahead and notify the doctor. Some people are saying you got to complete that incident report. That is very important. Some people are saying it is 4, consult the medication record, assess the client. But what do we have here? What's going on? A nurse gave the wrong IV medication, and it's a cardiac medication. So what is going to be your priority here? Does it change? Does it change? You guys, all right? And this is the hump, okay? This is the hump that we have to get over. And this question is really about critical thinking. This is a critical thinking question right here, right before your eyes. So I'm going to show you the answer. If you got it right, yay. If you didn't get it right, yay. Because that means that you're learning and you're here. You're in the right place. The correct answer is going to be hold on, here we go. Where is it at? There it is. It's going to be number 4. Number 4 is the correct answer because what? The nurse needs to assess the client before taking any further action. You cannot do any of the other things if you have not assessed the client. Everybody is going to be looking for what? Information. And so one way I can tell if a student is not prepared for NCLEX is if they defer their responsibilities to somebody else. That's one way, because when you don't know what to do, you just think another person will do it. So you say, yes, I messed up. I'm going to call the doctor. I messed up. I'm going to have respiratory fix it. If a patient tells me that they're having respiratory distress, I'm going to call respiratory therapy. And so when a student does that, I know that they are not ready to take NCLEX, because if a nurse fails to do something, there is an action that she needs to do on the back end of that. And so if we look at the choices that we have here, number 1 says, okay, if a nurse gives the wrong medication, then she should call the rapid response team, right? And some people pick number 1, all right? But when you call that rapid response team, what are they going to say? What are they going to ask you? What are they going to ask you, ReMar nurses? They're going to say, what is the condition of the client? What is their vital signs? You said you gave a cardiac medication. What's their blood pressure? What's their heart rate? And you as the new nurse, you just called them. You didn't even assess the patient. And they're going to say, who is this? Who am I talking to? Right? And so as a nurse, you have to be prepared to assess the client. That's the nursing process, right? That's the first part of the nursing process. So if you don't have that information, shame on you. Shame on you. All right. Number 2, notify the healthcare provider. Okay, you're going to call the doctor. Just think about it. You're working night shift. You're a new nurse. New nurses usually get put on night shift, right? And it's 3 a.m. You give the wrong medication. So you call the doctor and wake him up at 3 a.m. and say, Dr. Johnson, I gave the wrong cardiac medication. What's the doctor going to say? The doctor is going to say, what is the patient's condition? What is the patient's condition, Nurse Regina? What is he doing? And I'm going to say, hold on. I have to go take the blood pressure. What is that doctor going to do to me? He is going to yell at me. He's going to scream. He's going to say, it's 3 a.m. You woke me up and you don't have any information, right? And it happens all the time, right? So you have to be willing. You can't even fill out the incident report because you don't have anything to document, right? Except for that you gave the wrong medication. So you have to be in the mind frame of knowing what to do. Clinical judgment is so, so important. It's something I love for us to go over all the time. Exactly. The doctor is going to ask, did you assess this patient at all? Right? And so, yes, this is what we do on Monday. This is not the pharmacology review. All right. So if you guys love this part of the studying and you want to continue with me, it's graduation season. It's time for you to get all the way. It's time for you to go all the way in for your NCLEX exam. Guess what? The virtual trainer is where it's at. You guys know this is where all of my NCLEX information is, in the virtual trainer. And right now during ReMar Nurse University, it's $200 off. Have you guys made that commitment? It's time. It's over with. The games are over. This is the time to get the virtual trainer. You're going to get both books and the online classroom portion, 3 months access. Shoot over to remarnurse.com. And a special gift for you today. All right, this is the last day. You're also going to get a free copy of my first shift book, right? And that's how to dominate your first 2 years in nursing. All right. And that is my insider's guide to being a successful nurse, getting ready for that first shift. That book is free for every package that is ordered today. Today is the last day for that. So I hope you guys take advantage of it. I love first shift. Love it, love it, love it. Also, the class starts tonight at 8 p.m. Eastern time. And after that will be the after party. So join in the after party. It's going to be a good night tonight. After the 8 p.m. class, we're going to do an after party. And we are going to have our special guests from Grand Canyon University. You guys know this is a major college, and they are actually giving out a ReMar nurse scholarship. So you want to know how you can qualify for that. If you want to go back to school, yeah, if you want to get that BSN, this is the time to do it. So that's going to start at 9:30. So much good stuff is happening right now. You guys are not going to want to miss this event. ReMar Nurse University, learning before earning. Yes, learning before earning. This is our NCLEX motivation for this week. And it's really simply just this idea, this whole idea of you studying, you showing up. It is necessary in order for you to earn the lifestyle, the job, the income, right? This is all a part of the process. And so it doesn't matter, right? Nurses have to learn before they can become earners. And studying, what you're doing now, many people don't want to do, but I'm so happy you're doing it because it is the best way to increase your income, right? That money that you guys see yourself making, you need to know something before people just pay you that type of money. And so learners are paid because of their knowledge, because your knowledge affects everybody around you. If you know what to do in a situation, like we just mentioned, where somebody gives the wrong medication, if you know what to do in that instance, it is going to save somebody's life. People pay for that. People pay for that type of knowledge, right? If you know how to rehabilitate somebody with a stage 3 ulcer, people will pay you for that. All right. And so there is a direct connection between how much you study and how much you're going to make. All right. And that's why I am encouraging you guys all the time. You don't got to wait for the government to stimulate you with a stimulus check. You are your own stimulus check. You just have to see yourself as worthy of the investment. We are always investing into something. We are always investing into Starbucks, right? When we go there, we invest into McDonald's. We invest into Netflix. We invest into Disney Plus for our kids. And those things, they give you very little return. You get entertainment for a couple minutes. Yes, you get a nice frappuccino macchiato with extra caramel. Like those are good things. But when you invest into your mind, it repays you every 2 weeks, every time you get that paycheck. All right. And so it's a mentality, guys. You got to work to learn. You got to work it. And then you get to enjoy what you earn, not the other way around. Oh, my goodness. Listen, but it is all possible. And these are things you can decide to do today. All right. So I just want to say congratulations, because there are people that always pop up on here and they say, I passed NCLEX, and they send me videos. And so I'm going to show you guys actually an amazing testimonial. If you need motivation, let me show you this. Let me show you this. Who is next?
Hey everyone, my name is Regina M, and I recently took the NCLEX PN, and I was successful. I passed my test. Thanks to ReMar Nursing. Mark and Regina, they are amazing. The biggest thing I like with their program is that they are spiritually based. And since I believe that with God, all things are possible, and so do they, I knew that that was the right program for me right off the bat. So with this program, I got my virtual trainer and my quick facts book. and I used it diligently for about a month straight. Really, I mean, I subscribed for 3 months, but for about a month straight, I used this program. I mean, I was in my book like no other. I was writing, I was taking notes, I was listening. I mean, I was really doing what I needed to do. Also with the quick facts, it was like my Bible. I took it everywhere I went, and it paid off. I was successful with the full 145, but I made it. I passed, and I was a repeat test taker. I took it in November. I had a lot of things going on, and I think I just wasn't focused. But when I really buckled down, I got the ReMar review and the quick facts. I was determined, and with the encouragement of Regina and Mark, words can't describe how happy I am and how thankful I am, and how I just know now that life is about to change, and I'm forever grateful for that. So I just encourage every nurse that has taken the test, maybe never taken the test, or going to be taking the test, just know that you can, you will, and you must pass the NCLEX, and it's worth investing into this review, because when I tell you it's amazing, I mean, I felt so confident. I felt like I knew I could do it. I mean, I can't even describe it. It's worth it. So I just want to say thank you from the bottom of my heart. And I can, I will, and I did pass the NCLEX.
Who else needs to be in this situation? Who else is ready to give a testimonial? Who else is ready to pass NCLEX? Hey, ReMar Nurse University starts tonight. This is your time. I love what she said. My life is about to change. Is it time for your life to change? Are you ready for it? I am so excited for my next testimonial. Yes, let's go, guys. This is it. Check out this testimonial right here,
Hey,
too.
ReMar family. This is Diana, and I am here to give my testimony about passing the NCLEX. In March, I finished nursing school, and I signed up for the ReMar virtual trainer, which I received in like 3 days. I started it. I did it. It took me about 6-7 weeks. I finished the whole thing. I finished the workbooks and everything. And then I took my NCLEX this weekend and I passed. I could not do it without the help of ReMar virtual trainer, the help of God, and the help of the ReMar fam up online doing the mini classes, Monday motivation. And I loved it. I love the virtual trainer. It's like being in class. You just gotta do it at your own pace, finish the whole thing. You can, you will, you must pass this NCLEX. I did it. You could do it too. I'm so happy, and I just wanted to give you motivation that you could do it. And that's it. Good luck, everybody. You will love it. Thank you, ReMar.
Hey. No, thank you. Seriously. Who needs to get in their virtual trainer and just get busy? I mean, I don't know what other motivation. We have people from all backgrounds, people from all different testing experiences, whatever excuses you had, anxiety, fear, test date put off, COVID, all of that. Our ReMar nurses are passing despite it all. I just need you to believe that you can do it, because if you believe you can do it, God believes you can do it. I believe you can do it. Check it out. This is it. This is your opportunity. Opportunities don't come by every day. You got to be willing to jump on it. And that's just the difference between successful people and unsuccessful people. It's not the failure. You fail. You fail sometimes. It's hard. It's a struggle. But it's what you do after you fail. Do you get back up? Or do you stay down? Or do you try it again? And this is the opportunity for you guys to try again. ReMar Nurse University starts tonight. Excuses you have, whatever you're doing, cancel it. This is more busy. This is a better investment of your time. Go over to remarnurse.com. remarnurse.com. Just get the virtual trainer. Listen, we're taking $200 off of the VT package. So yes, if people are saying, oh, normally it's $289 and it's like, well, I don't really have $289. It's a lot. But right now the virtual trainer is what, $169. It's $169, literally $1.80 a day. You get 90 days in the virtual trainer. It's like the classroom. So take advantage of this opportunity. I'm telling you, a $169 is way worth the investment. Your life is going to change when you get your nursing license. All right. So yes, nothing. All right. Nothing is going to improve your life more than a nursing license. And so ReMar Nurse University starts tonight. You can order the virtual trainer. Don't forget, this opportunity comes once a year. We only do this once a year, guys. You absolutely can, will, and must pass NCLEX, but you got to be willing to try. You got to be willing to step out there on faith. Okay? Step out there on faith. Believe that you can study. All right. 2 books. This is the formula. And people sometimes they will just have quick facts and they will say, is quick facts enough to pass NCLEX? Quick facts is not enough to pass NCLEX. Invest in the entire program. All right. Invest in the entire program. These ladies that came on today, they had the entire program. They're not saying I just studied the free videos or just quick facts. Those things help. But the core recipe for knowing what to study, how to study it, and how long to study it. That's the thing. This does not take years and years. All right. This can be done by the end of RNU. By June 28th, you can have your virtual trainer and have completed it. Okay. Imagine having your nursing license in August, in July. What would you do? What would you do? How would your life look different? Okay. How would your life look different? But you have to see yourself as worthy of the investment. Okay. Because there's no price that you can put on the happiness that you feel when you get your nursing license. And so I'm here for it. I'm ready for your journey to begin. And I will be back tonight at 8 p.m. Eastern time to go over pharmacology. So head over to remarnurse.com, get the virtual trainer. This also is the final day that we are adding the first shift book to every VT package. It's just a beautiful time. Once a year, this happens and the time is now. So that means that your time is now. And you can, you will, and you must pass NCLEX.